lecture, I'll be specifically focusing on the adolescents. Adolescent is a unique formative time full of turbulence, and it is also forms a significant proportion of population, not only in the world, but also in India. 1 in every 6th person falls in this age range of adolescent. And as I said, that it is a period of stress marked by physical changes followed by emotional and cognitive growth. So it is a period when there is a lot of identity formation goes on, and there are decisions to be made with regards to their own value system, and career goals needs to be identified. And also when they start connecting with the family, rather than the family members, they want to reach out to the peers. So with this in background, we need to understand how the pandemic has influenced the adolescents. Before that, I would also like to highlight that mental health among the adolescents, as it is this age is vulnerable to mental health issues because of the stresses involved. And half of the mental health conditions, even in adults, if we go look at the trajectory, then it starts around the 14 year of age, and it often goes undetected and untreated. Suicide, which is the third leading cause of death in this age group. And I would say that in this pandemic, it has increased significantly. So if we are not able to address their help-seeking process, it affects their physical as well as mental health and limits the opportunities to lead a potentially productive life. There are various reasons why they do not seek help, most of it being a lack of motivation, lack of knowledge. No. So in this scenario, how the various issues have influenced the adolescents. Talking about the at the individual level, since morning we have been talking about school and colleges closure. The school, college, which is the most important place where the children connect, where they develop their social identity, and need to understand how we need to ascertain and mitigate the effects of the closure of the schools. It is most urgent and essential. The adolescents, because of the lockdown, have been at home. The exams, though now the decisions have been made, but there has been a period of uncertainty that whether they will be held, how they will be assessed, the internal. We have been in the process during the pandemic. We have been seeing cases, even face-to-face interactions are being held, and they often have reported their fears, their stresses, that it will not be fair this time because my internals were not so good. I really put in my effort during the board exams, but now I don't know what will happen. So it has been gained for few and lost for some. Some of the interviews have been cancelled in the professional colleges or in the other colleges, and some of them who were depending on the interviews, now they don't know what to do. So these are some of the worries that are being communicated to us while when we see the patients with adolescents with depression or with other mental health issues. Classes have begun online. So now what are the various issues? This online classes are also laden with a lot of problems. Many times we do not understand, but when one sees like we know the digital divide is there. Many significant proportion do not have access to internet. People who have access, sometimes the net gets broken. They are not able to enter their class. So these are the issues which lead to constant worry. At the family level, all the family members are sometimes they are working at home. There is increase in violence. Some people have lost their jobs. There is a financial crunch, And some people who had faced, some adolescents have faced even death in the home. At the social level, when we are talking about that adolescents need to be more social, using though use of mask is common in some of the countries, but here in India, adolescents are not too comfortable. When we see, I remember a case which I have been seeing for last 2 months. Whenever I have a session with him, he either pulls down the mask or he becomes quiet. So it's difficult to connect with him with the mask on. So when we talk about that your family is there, you can connect with them. Uh, he, they often report about space. I don't have space on of my own. So at one point we are talking about isolation. At the other level we are talking about space. So these are the paradoxes which have emerged during this pandemic. Then they have time on their hands, but we cannot avoid. Parents have family members report that over the time their restrictions have worn down. They can't do anything with their excessive use of internet. Either they are playing games, or they are on screen for the schools, or they are connecting with their friends on the screen. So these are some of the issues, and we can see that there are multiple levels at which these issues are arising, at the individual level, at the family, at the social, as well as at the society level. So with these in background, at the same one thing I would like to show here, that not much of the data is available, but recently we conducted a study on gaming behavior among the students, and we found that 50% of them reported increase in gaming behavior. 14% reported decrease in the gaming during the lockdown period. So increase in gaming was found to be related to examination related stress. So we don't know how these behavior have changed over the time. So there is a need for data generation to understand the process of the influence of pandemic among this section of population. Social COVID-19 is taking place in a new technological context, and social media is playing an important role during this COVID. It enables socialization and communication. It also provides swift critical guidance related to pandemic, related increase in infection, deaths, and the lockdown in various parts. It also means that it amplifies perception of the risk. It listening to news 24/7 about increase in the cases, it leads to anxiety. It leads to repeated media consumption, creating a cycle which is difficult to break. Studies have shown that time spent on social media correlates with depression. So, with all these issues and the anxiety which is being created among the adolescents specifically, there are various recommendations that have come up by various organizations, WHO, UNICEF. However, we don't have any hardcore data to say that what works and what doesn't work. At the level of individual, when we are talking to the adolescents, we really emphasize on the structured routine. We tell them that even though the classes are beginning late, or if there is a closure, so please get up early, get ready as if you are about to start your day. You'll feel fresh. You should be emphasizing, though there is lack of physical activity, so start looking for the ways where you can exercise. Maybe it is dance, or maybe it is yoga, depending on the interest. We ask them to identify small goals so that they have the feeling of accomplishment. It is imperative to highlight that this is the age when they are most bothered about their academics and the career. So we teach them how to cope up with this uncertainty. Tell them it is okay to be stressed. It's a period of unprecedented times, but it's happening with every one of us. So it's at the same time, we are also emphasizing on other activities besides being on internet. We are talking about cyber safety. So in at the level of individual, one talks about behavior change, adaptability, uh, behavior change in terms of when we are talking about various precautions to be taken. Uh, the three personal protective behavior of hand washing, not touching the T-zone of face, maintaining physical distance. We need to prepare them to feel motivated to follow this behavior change even after COVID. At the level of family, we ask them to learn to connect. Yes, most often, many times the family members say, what do we do with our child? They have been connecting with their peers and now there is nothing, they don't want to connect with us. So we need to identify activities where we do activities together. Many times we tell the adolescent to communicate that they need their space, what they like, what they dislike. So it's a challenge for the parents as well as for the child. Most often we ignore this. If you look at the literature, in fact, we hardly find mention of studies which are focusing on children or adolescents. There are very few studies which are primarily focused on the issues concerning adolescents. When we look at the mental disorders that are being reported among adolescents, it's ranged from minor adjustment issues to mood variability, frustration, irritability, anger outbursts. When some of them who have faced trauma, death, it's not surprising that this may suffer from severe depression, anxiety, bereavement, even suicidal. I'm seeing a case recently who has seen death of the father in his own room and feels so guilty that he is not able to focus on his career. Not surprisingly, they waste their time on the net because they don't feel like focusing on other things, things which are more relevant right now. So we talk about cyberbullying and which is most important so that they are aware that these things happen. Adolescent is a period where they are more vulnerable to alcohol and substance use in the event if they are stressed out. So if one finds we talk mental health problems or of such nature that they need to seek help, in that context, we talk about cognitive behavior therapy. We talk about digital mental health interventions. In Indian context, unfortunately, we don't have data. When we look at the literature, we have data. I'll be coming about on that, the issues related to that. At times, even pharmacotherapy is required to deal with depression and anxiety. So we should not be ignoring it. We should not be ignoring when the child says that I don't feel like eating, I'm not feeling sleepy, or he's spending all the times on the net. But there are challenges, as I've talked about, the fear, motivation level, lack of knowledge, stigma. But at the same time, we need to prepare them for the challenges ahead. We need to shift them back to routine with mask and physical distancing. We need to tell them it's okay to be little distressed. We need to teach them new goals, short-term goals, so that they tide over this crucial, difficult time. And we prepare them to seek help. Although at the level of psychological intervention, for those of you who are in this, who are students of psychology, I thought I would like to mention that CBT, cognitive behavior therapy, which has been found to be most effective, there are randomized controlled trial to say that it is effective for common mental disorders. And recently, reviews have been done on substantial number of studies to show that interventions through websites, they work. They're either effective on few or partially effective. But the effect size, on the other hand, another study, another meta-analysis showed that it is small. Engagement and adherence is low. The youngsters, they find educational material to be boring. In Indian context, we do not know, in the absence of internet, how do we go about it? There is data on teleconsultation. We are indulging in telepsychiatry at AIIMS, at NIMHANS, at various other centers. Various helplines have come up which ask the person to connect through telephone, through video conferencing. But the issues of therapeutic alliance comes up. Establishing relationship is difficult, even though it is without mask. Then also one feels there is a barrier. And for any therapy to be successful, it's very essential to develop therapeutic relationship. Confidentiality is another issue that we often talk to our students who are dealing with adolescents or children, that sometimes when you are online, make sure that the child is alone in the room. Most often, the parents sit with the child because he feels that he may not be tech savvy or there might be problems. But when we are having a session, it's important that we have session in with the family as well as alone with the adolescents. So, but many times when the session is going on, there are issues related to connectivity. There are breaks in between, which tends to break the flow. So such issues cannot be, we have to accept and still move on. So now the question is, digitalization works better or face-to-face with mask? We are dealing with both kind of situations. Adolescents, the question is that they are already at an age where they have a mind of their own. They have to be convinced that seeking help is not stigmatizing. It's but at the same time, we do get to know that many of the therapists, they have opted for online sessions only. So face to face is not available. Then the question of also giving if one goes towards digitalization for intervention, then the question comes that do I give my phone number to the person? Can I trust the person? Most often this is resolved by giving a number which is not of regular use in your, like for your daily use. It's not your personal number. Either it works through, like we get a number through AIIMS where we are transferred the call through, we have direct helpline numbers where the students can contact us. So one has to see the situation. So no one size fits all. So it depends on the case, it depends on the adolescent, it depends on the situation, what will work for whom. As it was said in the morning, that one cannot work with the adolescents or with anyone else alone. It has to be a effort made by all of us, whether it is anthropologists, psychologists, sociologists, and I would say teachers, policymakers. All of us play a role when it comes down to students. We often get to hear about the teachers, how they are taking online classes, whether the teaching is interesting. I know someone said recently that he was a very recommended teacher, but the student said, I don't want to take his class because I'd sleep. I find it very boring. Maybe face-to-face he was interactive and very good. But when it came down to online teaching, the child was not eager to learn from him. So it's a challenge for the teachers to change their ways of teaching, to be aware of the technology, how it can help us to get across the material. Uh, Sometimes the children, we are often talking about online classes for long hours. So what kind of timetable should be prepared so that it's good for everyone? It breaks continuity, at the same time it works for teachers as well. So these are some of the challenges that the teachers face, that the adolescents face, because it is the adolescents who have to face the wrath of learning. At the level of policymakers, last but most important, I would say that when we talk about the adolescent, we say live for today, live in present. But as policymakers, as teachers, as people who have to resolve the issues, we have to anticipate problems. Where can we help them? How we can help them? Whether this method is cost effective? How it will impact the lower income families? So we need to take into cognizant all these issues and then make decisions. With this, I come to an end of my presentation, and it's
240.
Okay, all right then. So we'll take a little questions in between. So because we have a liberty, because our organizing team has given us some kind of liberty to clarify some of the doubts. Even though ma'am has very clearly explained about what are the consequences and what are the things. So I have a little some kind of clarification from madam, if not kind of question. So madam, do you have any group of scholars, so possibly from your department, who try to help the students within the peer groups? Say, because very interestingly, one of my niece who is doing PhD in psychology, they have a peer group. So during this COVID pandemic, their peer group keep counseling, online counseling to their friends. Do you have any group of this sort?
uh, are you asking about AIIMS as such? Yes. Okay, I would like to share my experiences we have nurses students, we have resident students, we have PhD students. Uh, we have the institute has initiated uh, several ways of connecting with the students to decrease their stress, and we are having a lot of residents and the students having depression, anxiety, and even suicidality. So to deal with that and isolation, and along with that there is a lot of workload also, and the whole system has been revamped because of the cases that are rising every day. So there is uncertainty, what will come next, where will I be posted, and what will I be doing. To First of all, I'm just highlighting the issues that we were having at AIIMS. Then the students, the psychology students were facing that when we are seeing the cases, how do we make a diagnostic assessment? We have been using Rorschach, we have been using paper pencil material to make assessment. We have been interacting with them. The facial expressions are so important when we are making assessments during the therapy. So these were the issues that were being faced. First of all, to list down the various activities that we have been doing, we have a student wellness center at AIIMS, that where we have uh, uh, from 8 to 8 counseling is available. We have from the Department of Psychiatry, we have helplines available where we can be connected with our own students as well as the patients or anyone whosoever wants to connect with us. Within Student Wellness Center, we initiated many activities for our students as well as residents, because they were far from their families. Because of the lockdown, they could not go, the family members could not come, and they were staying in room alone. So we initiated many clubs. We have a song club, we have a dance club, we have lectures by the senior faculties, we have other activities like playing in a group through online media, which then we have cookery classes, which we found that the residents and the students were very, very interested in. So these are regular activities which are happening every day so that students do not feel isolation, they connect with others, and this has definitely reduced stress. This is the feedback we have got from the students. As with regards to the academic activities, we are with our students wherever, whenever they verbalize their worries, we often are able to come up with alternative solutions. We have started video conferencing with the patients. We spend more time through video conferencing, we try to assess, and we try to but at the same time we do have face-to-face sessions. We have PPE, protective gears, the students have it, and so we are taking face-to-face sessions also. But then the issue is of face mask and all that, where we do not feel so connected. So we prefer video conferencing in such cases. It depends on the case per se also. But with all these activities going on, I think we have been quite successful in reaching out in connecting with the students in these difficult times.
Okay, sir. So I'm reading the questions. We have a question from Shagufta. She says, thank you, ma'am, for the wonderful lecture. Ma'am, I just have one small query. Do genetic makeup of patients affect the efficacy of online therapy? What is your opinion?
I would not really say it's the genetic makeup that makes though there is no data per se, but definitely since the nature of the person, whether he is shy or he is extroverted, that helps in establishing the rapport. I don't think the efficacy of online, whether it is online or offline, it's basically the question is whether the skilled enough to reach out to the patient. So even if the patient is shy or introverted by nature, which is having because of it's the therapist's skill which would affect the efficacy of the therapy. But as I have highlighted, the other issues which come in the online session, they are important. I would not, I think there is no hardcore data to say whether genetic actually plays a role or not, but I suppose so.
Thank you, ma'am, for your response. We have another question from Ashwini. How can we be much more understanding for adolescent gaming behavior, and how can we interview them without aggravating their stress, mental health issues?
See, gaming usually starts with here one is not talking about the COVID per se, one is talking about the general adolescent gaming behavior. So gaming, the literature documents that gaming usually starts with curiosity, by using time which otherwise was boring. And also in the influence of other peers. So if one wants to curtail gaming behavior in the beginning, one just needs to restructure the schedule. If it's a gaming disorder, then gaming disorder also means that, excuse me, that there are withdrawal symptoms, there are the patient has developed tolerance for this behavior. So cognitive behavior therapy will be required for intervention. Also, we have often found that with adolescents, taking along the family in intervention is very, very effective. One needs to involve the family members to engage engage the adolescent in a positive, productive behavior. So in this, the help of the family members is taken, and as a therapist, one identifies various activities which both of them can find to be meaningful and pleasurable. because gaming initially gives pleasure. Later on, some of the games like PUBG, they have addictive properties as well. So in psychological terms, CBT with relapse prevention cues for relapses, they are taken into account. But in layman language, structured activities, they do help to distract the adolescent from gaming.